Well, more than 20% of Americans will have cataracts by the age of 65, but there's good news for these patients.
Here to tell us about groundbreaking technology to help improve vision for cataract patients is Dr. Kashyap Kansupada with Charlotte Eye, Ear, Nose, and Throat Associates. Thank you so much for being here this morning, Doctor.
Well, good morning, Colleen and Eugene. Thank you for having me on the show today.
Of course, it's great to see you. Okay, let's talk about cataracts. They're a common eye condition. What do patients experience when they have cataracts?
Great question. So back when we were younger, we can tee up the first image, and it's kind of enticing. Okay, the top image right there is what normal patients would see with full range of vision, being able to see far away and up close, and everything in between. As we mature, a cataract is nothing more than the lens inside the eye that becomes cloudy, and it typically starts in our mid-50s. Initially, when the cataract grows, your prescription changes, and so you may need to update your glasses periodically. But eventually it gets to the point where, as you see in the bottom left image on that same image, if we can pull it up please again, where the vision becomes cloudy, becomes yellow, and you can see at the bottom left there. And it makes it difficult for you to do your normal activities, whether it be reading, watching TV, sewing, enjoying church services, and driving, where people might notice glare from bright lights or headlights, glare from the sun or glare from headlights at nighttime. But it's not until it gets to the point where, and the image on the, bring it one more time please, on the bottom right shows what glare would be, where the bottom far right is what normal patients would see, and just to the left of that is what patients with cataracts might see with the glare.
Okay.
But eventually it gets to a point where new glasses can't help. And in that situation, and you're unable to do the things you want to do, a 6-minute outpatient procedure can then replace that cloudy cataract with a new crystal clear lens implant to resume your normal activities.
And this is what I want to talk about. The FDA just approved a Symfony lens. Can you tell us a little bit more about that?
Yeah, the Symfony lens essentially incorporates the same technology that NASA uses in its telescope lenses. And as the name implies, Symfony brings together astigmatism correction, extended range of vision, as well as true colors to have more natural vision.
Oh, so it helps with all of those things?
Correct.
Oh, that's a wonderful thing to know. So it's other problem, not just for the cataracts?
Correct.
Okay.
Correct.
Okay.
Well, how does these implants, how does it restore your vision, though? How does it do it?
So in folks who have cataracts, the Symfony lens corrects astigmatism, nearsightedness, farsightedness, and presbyopia. Nearsightedness, which the viewers, many of them, and you guys also know, allows you to see up close, but you really can't see far away.
Yep.
And farsightedness is the opposite.
It's opposite.
And astigmatism, which you might understand better than most, show the image please, is where the front of the eyes and the shape, you look at the top image there, where the front part of the eye is more shape of a football than a basketball, where the up and down curvature is different from the side to side curvature. And so that causes light to be focused in two different places. And so the vision, as you can see in the image below, is distorted. And sometimes you see double with that. Presbyopia, the last thing that the Symfony lens takes care of, is what most of us in our 40s appreciate, where our arms are just not long
like
enough.
this?
It ain't long enough.
I do this all the time. Yes. Yes, it's all the way out here. Right.
Symfony lens.
So what benefits can patients expect then? They can have a clearer vision?
Absolutely. So most patients, when both eyes are done eventually, enjoy robust color, enhanced ability to, as you can see in the image right here, enhanced ability to see in dim and dark settings for reading and those kind of purposes, and as well as resumes their ability to see far away and up close and everything in between, whereby most patients don't need any glasses at all after surgery.
Oh.
That means, of course, that some still do, and when that happens, it's usually for fine print and those kind of things. Now, with this enhanced quality of vision, many patients will also be able to enjoy or be able to regain self-confidence in their ability to drive and do other activities, enjoy active pursuits again, and most importantly, be able to maintain their independence.
A 6-minute outpatient procedure will take care of all of that. To learn more, call Charlotte Eye, Ear, Nose, and Throat Associates. The number, it's on your screen, 704-295-3000. Again, 704-295-3000. You can also visit their website. It's easy to remember, goodsenses.com, goodsenses.com. Thank you so much, Doctor, for being here.
Doc.
Appreciate it.
Time.
All right.